Good evening, everyone. Welcome. Thank you for joining us for this virtual UMiami Health Talk, Navigating Diabetes During the COVID-19 Pandemic. It's brought to you by the Comprehensive Diabetes Center at the University of Miami Health System. I will be your program moderator for this evening, health journalist Ileana Bravo. The Comprehensive Diabetes Center offers leading expertise from a multidisciplinary team. Our experts develop a customized treatment plan that fits into your lifestyle using the latest advancements in diabetes treatment, including promising new treatments through clinical trials. Our UHealth diabetes specialists are ready to care for you in our facilities, virtually, wherever you are. And of course, we invite you to learn more about the measures that we have in place to keep you safe in our clinics, as well as your appointment scheduling options by visiting umiamihealth.org. Well, tonight we're privileged to hear from 3 University of Miami Health System experts. Each of our panelists will speak on a different diabetes-related topic and answer your questions. First, we have endocrinology expert Dr. Rajesh Garg, who will talk about how to manage your diabetes during acute illness and provide valuable information on what to do if you find yourself in this situation. Infectious disease expert Dr. Dushantha Jayawira will discuss the relationship between COVID-19 vaccines and diabetes. And lastly, certified diabetes care and education specialist Monica Grimaldi will share how to manage eating healthy during quarantine or acute illness. And just to give you a little bit of the format for tonight, after each panelist presentation, we are going to poll you, the audience, on questions relevant to the discussion. So we ask you to be interactive and take part. Your answers will be anonymous. There's also going to be a question and answer session at the end of the presentation to answer questions many of you have already submitted in advance, but if you didn't, don't worry. You can still enter your questions using the anonymous Q&A feature. Now it's at the bottom of your Zoom screen, so take a minute to locate it. You'll see 2 thought bubbles that say Q&A. That's where you're going to enter your questions. Our experts tonight might answer some of them directly, or some will be left for our live discussion. So please enter them as you think of them. Now, I'm pleased to introduce our very first presenter this evening, Dr. Rajesh Garg. Dr. Garg is a professor of medicine at the University of Miami and an internationally recognized expert on diabetes. Before joining UHealth in 2017, he was an associate professor in the Division of Endocrinology at Harvard Medical School, where he completed an immense amount of research work on diabetes. Dr. Garg directs the Comprehensive Diabetes Center's outpatient clinics at the Lennar Foundation Medical Center, that's in Coral Gables, and at the Diabetes Research Institute in Miami. He also directs the diabetes program at Jackson Memorial Hospital. Dr. Garg has had a major impact on diabetes care in South Florida and has improved the clinical outcomes of patients through his innovative methods of treatment. Please join me in welcoming Dr. Garg.
Thank you so much, Ileana. So thank you so much for everybody joining us this evening. I wish this event was in person. We try to celebrate this Diabetes Awareness Month by having a community event, but due to COVID, we cannot have that in-person event, and that's being replaced with this webinar. So I hope you guys get useful information this evening. I'm going to tell you a little bit about how COVID affects diabetes and how diabetes affects COVID, and what you can do to prevent these illnesses, and how, if you do get sick, how you can manage that. So this is something that we realized very early during the pandemic, that people who have diabetes, they are more likely to have serious complications, and they are more likely to die from COVID-19. Actually, in some of the studies, as many as 30% or 1/3 people who died, they had diabetes. So if you have diabetes, your chances of getting serious complications due to if you get COVID-19 infection are pretty high. Not the other way around. We haven't seen any evidence that people who have diabetes are likely to get more infections. But in general, please stay on the previous one. So in general, people with diabetes, they are more likely to have severe symptoms with any infection, including any virus infection, flu or anything else. So COVID-19 is more serious illness in any way, so that they are more likely to get more sick. Having other complications, and we have seen that during the COVID pandemic, obesity, high blood pressure, heart disease, that makes the illness much worse. And the mortality increases quite remarkably if someone has pre-existing heart disease. Getting seriously sick is less likely if your diabetes is well managed. Next slide, please. So I like this cartoon that was published about a year ago. What it shows is that if your diabetes is well managed, which means your blood glucose is mostly less than 180, and some of you who see me in the clinic will know that I always emphasize keep your sugars always below 180. So if that is how your diabetes is managed, then the chances that you will fight COVID-19 in case you get it are pretty good. So you will be able to fight off COVID-19 infection and survive it. But if your diabetes is not well managed, then we know that COVID may have the upper hand. So the chances that COVID will win increase if your diabetes is poorly controlled. So the good news is that yes, if you are well managed, the risk of complications does go down. Next, please. Now, how COVID-19 affects diabetes control? Like any other acute illness, COVID-19 is a serious disease, and it does make diabetes control more difficult. If you have type 1 diabetes, or even in type 2 diabetes, we have seen that acute complications like diabetic ketoacidosis, that commonly people call diabetic coma due to high sugars, it becomes more often. So the chances of getting diabetic ketoacidosis are higher with any acute illness, but especially with COVID-19. And I personally have seen a lot of patients who have type 2 diabetes typically, but they get COVID and they get into diabetic ketoacidosis. And it can become challenging with illness because you have poor appetite and then there is a stress of illness. It's harder to manage fluid and electrolytes. And moreover, some of the medications that we use for COVID-19 infection, they make your diabetes worse and it becomes harder to control. So if you're already poorly controlled or your sugars are running high, and then over that you have acute illness, it makes diabetes control much worse and harder to control. And if you get into acute complication of diabetes, like diabetic ketoacidosis, the treatment of DKA is a lot of fluids and electrolytes, and that makes it much harder to manage both illnesses together. Because COVID-19, which is more like sepsis, also needs balancing of fluid and electrolytes, and the two together makes it much harder. So the bottom line is try to keep your diabetes under good control and try to prevent COVID-19 if to the extent possible. Now, there are also certain anti-diabetic medications, especially some new ones that may need to be held during acute illness. And if you do get seriously ill, then it's better to communicate with your doctor and ask if there are any medicines that need to be stopped and what to do. Next slide, please. The best is prevention. So some of that we already covered. It's good glycemic control, taking medications, good eating, exercise, healthy lifestyle, stress management, sleep. But the best way of preventing COVID-19 infection is vaccination. That's the best way we know of. So COVID-19 vaccination, that is the most effective way of preventing the infection. Next, please. So what else you can do? As always, please take a flu shot if you haven't already. Even if you have taken COVID vaccination, flu shot is still essential because the two are going to be there, COVID as well as flu during the season. And so it's important to prevent both. Flu kills a lot of people in the world every year. So get your shot. Then cover your nose and mouth, especially if you are going into a crowded place, even if you are vaccinated, because there are breakthrough infections. Wash your hands, that will prevent flu as well as COVID. And if a member of your family becomes sick, then try to give them their own room, and if possible, keep the door closed. Only one family member should care for them so that not the whole family doesn't get infected. And that's true for all viral infections, including flu. If someone in your household is older or has underlying health conditions like cancer or are on anti-cancer drugs, there are special precautions additional that you should observe. Next, please. Now, if still you get sick, sickness can be COVID or even flu. These are the things that you need to observe to stay healthy during sickness. Do not stop insulin. The dose may need to be adjusted. If you have type 1 diabetes, probably you have been dealing with it and you have been trained how to adjust your insulin doses. If not, call your doctor and get advice. Certain medications, as I said before, may need to be held temporarily. Then drink a lot of fluids, small sips. If it's hard to take, eat or drink too much, take small sips every 15 minutes so that you keep well hydrated. People on insulin or on sulfonylureas, they can develop low blood sugars, and the treatment for low blood sugar is that you take simple sugars like juice or soda, regular soda, or honey, jam, and make sure that your sugar goes up above 70. You may need to check your sugars extra during acute illness to prevent low blood sugars as well as to prevent high blood sugars. And if your sugars are high, in general, more than 240, and especially in those who are on insulin, check your ketones. Make sure you are not going into diabetic ketoacidosis. And if you do have large or medium ketones, then you should call your doctor immediately. And then people who are using continuous glucose monitors, more and more people are using those devices. Just keep in mind, sometimes they can give erroneous reading, especially in acute illness. And also when you're taking some common medications like Tylenol. So you may need to check or at least cross-check to make sure that your readings are correct. If you have doubt, just do the finger stick glucose. Next, please. Now, when to go to a hospital, things still can happen despite all your precautions, despite vaccination. Flu vaccine is relatively less effective, even though it prevents major illnesses. If you have difficulty in breathing or shortness of breath, or you feel chest pain or pressure, or have confusion and have difficulty in staying awake, or if you're a family member and you see that your relative who has diabetes is sleeping too much or it's difficult to wake them up, that's time to go to hospital. Bluish lips or face is also a sign of low oxygenation. And most importantly, if you cannot keep fluids down, because that's the most important part of managing the acute illness in diabetes, you have to be well hydrated. Next, please. And stay prepared, because you never know. We don't anticipate any supply chain problems. Insulin as well as other diabetes-related supplies, we don't anticipate that there will be any shortage. That's based on the reports from the ADA and from the CDC. Have your phone numbers ready. and just keep simple carbs in case you get hypoglycemia, especially if you're taking insulin and sulfonylureas. Keep enough medications and supplies of insulin testing for at least 2 weeks in case you cannot go out of home or you cannot refill. Extra supplies for alcohol and soap to keep clean. Make sure you have glucagon if you are on insulin, and ketone strips in case of low, high sugars, and have enough supplies in the household for at least 2 weeks. Next, please. So that was all that I had to tell you today. And this is the question that Ileana, you can take over, please.
Thank you very much, Dr. Garg. I sure will. So let's get in it, audience. The first poll question is, if you have received a COVID-19 vaccine, do you still need to receive a flu shot? It's a yes or no answer, and we'd like to see how you have done in answering this. If you've received the COVID-19 vaccine, do you still need to receive a flu shot? We think about this, we've discussed this, everyone in our family and friends asks this question, have you gotten the flu shot? And so let's see how we all did. Yes, 98%. I think you should be proud of them, Dr. Garg, right? They answered it properly.
Thank you so much.
Yes. Okay, well, let's move on now to our next presenter, Dr. Dushantha Jayawira, who's been working in infectious disease for 2 decades and is a professor in clinical medicine at the University of Miami. Dr. Jayawira was the Executive Dean for Research and Senior Associate Dean for Research at the University of Miami Miller School of Medicine. And prior to that, the Associate Vice Provost for Human Subject Protection with regulatory oversight over the IRB and Human Subject Protection Office. He's one of the lead investigators in the Miami Clinical and Translational Science Institute, which helps to ensure alignment of research operations with institutional resources. Dr. Jayawira has been a principal investigator and a co-investigator in many NIH-sponsored studies in infectious disease, drug abuse, and the site principal investigator of many industry-sponsored infectious disease studies, such as site principal investigator for the Janssen COVID-19 vaccine study, the PCORI-sponsored healthcare worker exposure response and outcomes of hydroxychloroquine study, and the convalescent plasma to limit coronavirus-associated complication study. A mouthful, and that's why we are welcoming this expert tonight, Dr. Jayawira. Take it away, Doc. I think you need to unmute, and we'll get your presentation up. There you go.
Yeah. Thank you, Ileana, and it's wonderful to be here. And thank you for moderating this. I want to thank Dr. Garg, who has put together. He has done amazing work on diabetes, and also the communication staff, and of course Dr. Weiss, who led the COVID whole pandemic. He single-handedly was the conductor of the orchestra, to say the least, that managed to get everything done. So today my talk is going to be on COVID-19 and diabetes. And I would mostly concentrate on COVID-19. And I know there are multiple questions that you have to ask. And one of the things is about the COVID variants. What are these variants and how does this happen and why did it happen? Everybody wants to know what happened with the variants. Did we know that the variants were coming? Of course we knew variants were coming. Every virus creates variants because viruses, that's what they do. And then, of course, I'm going to talk a little bit about long COVID. It's also called the post-acute sequelae, or PASC. I don't know who come up with these names, but it sounds good. And then I'm going to talk about 2 new drugs called molnupiravir. That is the most difficult word in this slide to read. I had to Google it, but it's one of the new drugs that came from Merck. And it's the first oral antiviral medications for outpatients for COVID. And of course, I'm going to talk briefly about Paxlovid, which is a Pfizer drug boosted with ritonavir for the patient. Now, before I go to the next slide, when I thought about explaining COVID-19 variants, I thought that the best way is to show a video. It's very simple, and I'm going to play this. This is from the CDC, beautifully done. It's very short, and the music is good, actually. So let's play the video. Okay, so that's wonderful. So now you may ask, now why do viruses mutate? So the real reason the viruses mutate, like the other virus like flu and HIV and hepatitis C, is that when the virus replicates and it makes a copy of RNA or DNA, it lacks the proofreading mechanism. So it can't check whether the copy what they made were the same as the original. So spontaneously, these viruses make mistakes, and that's how these variants come. And then, of course, the survival of the fittest. So the video clearly shows how everything changes, and then the ones who have a survival advantage will come up and take over. So you can see that from the wild type virus, the alpha variant had one mutation, 501 mutation, which helped the virus to spread more easily. So for a for a virus to spread easily, it has to spread easy, and also it should be able to overcome the resistance like the wall on that video. So when the alpha variant came, it was a single mutation, N501Y. The beta had extra mutations, and the delta has different mutations. So you can see that when we got the delta variant, the virus completely took over. For example, end of July in Jackson Memorial Hospital, we had on the 20th of July, we had something like 15% of Delta variant. By the first week of August, it was 98%. Almost everything was Delta variant. So you can see how the variants happen. So the next slide, please. Next slide, yeah. So the question is now, what happens with the vaccines? Now, before I go to the effect of vaccines on the variants, I want to emphasize what Dr. Garg said a little while ago. The vaccine is the best preventive method to prevent complications with diabetes or no diabetes. So during September, this is from Texas, risk of COVID-19 deaths were 23 times higher in unvaccinated people, 23 times higher. If they are in the 30s, it was 55 times higher if you're unvaccinated. We're not talking about hospitalization. We're talking about deaths. We're talking about death. So when people think that, oh, I can get away with not getting vaccinated, it's really a very dangerous game. And of course, 10 COVID-19 deaths in September were among fully vaccinated people compared to 339 deaths among unvaccinated people. And of course, even if with vaccination, things can go wrong, especially if you have other comorbidity like a cancer or really bad lung problems with diabetes and other complications. Even with vaccination, that could happen like anybody else, especially things are not under control, like Dr. Garg said. Next slide, please. So now I'm going to get some questions which I heard from different constituents, my clients or my patients who have asked the question. The first is, are boosters the same formulation as vaccines? So people were under the impression that the current boosters were all modified vaccines, which are modified to overcome the activity of a variant. It's not so. It's the same vaccine that's a given, but in the future, it could happen that you get a slightly modified vaccine. The second is that if we need boosters, does it mean the vaccine doesn't work? Absolutely not. The vaccines are working, even against Delta. But the issue is that as after some time, your immune system wanes and the virus antibody goes down. So therefore, that this could, you need boosters. The third is that what are the risks of getting a booster? I mean, people are worried that, whether, there are some complications that can happen with vaccines, like, some people has got myocarditis, very, very small percentage. Some people have other complications, but the boosters are no different from any vaccination. So they are not at an added risk by getting a booster. Can I mix and match? Of course you can mix and match. But when you take the same vaccine as a booster, it is, I guess the effectiveness may be slightly less, but the safety is better. But if you mix and match, the effectiveness may be much better. But of course, if you're mixing things, the risk may go slightly higher. So most of the time, the CDC says, yes, you can mix and match. Another interesting question I have been asked is that if I had COVID-19, why do I need a vaccine? I mean, I already generate antibodies. My immune system is good. I don't have other problems. So why would I take a vaccine? The reality is that it is true. It is true if you get COVID that you develop antibodies. But the amount of antibodies developed depends on the severity of the infection. So if you're hospitalized in ICU, you get a really good immune response. But if you're at home with a mild infection, your immune response would be much less. Overall, the problem is that we don't know the durability of the immune response compared to a vaccine. It's not, we don't have data to say one is better than the other, but at least we know with vaccine the durability of the response. So the most of the scientific community suggest or recommend that you should get another vaccine even after COVID-19. So am I still vaccinated if I do not get a booster? Yes, you can't say that I'm not vaccinated. You're already vaccinated, but if you get a booster, your immune response will pump up by a couple of folds of antibodies. So it should be like that. So when can I get a booster if I'm not in one of the selected groups? So the CDC is trying to see whether they can change change the criteria for boosters, and they may try to make other people also the boosters available. Next slide, please. So how long am I infectious after COVID? That's another, I mean, this has happened to my colleagues who are infected at UHealth. So if you're mild to moderate infection, you got usually 10 days. 10 days is all that is needed. People who are severely infected or immunocompromised, you may be infectious for about 20 days, because basically your infectiousness depends on the virulence of the bug against the host immune response. So if you're immunocompromised, then this could happen. The other thing is that the people who are infected sometimes have persistent viremia. That you don't have to worry too much. As I said, if you're immunocompromised after 20 days, or if you're not immunocompromised 10 days, even if you have a test positive, you're not infectious. So you don't have to worry. Next slide, please. Now, briefly, I want to touch about the post-acute sequelae. One of the problems we see with COVID is that the people say that, if I get COVID, what's the big deal? What's the big deal? The big deal is that sometimes people get, after COVID, you recover, you develop symptoms, mostly after about 4 to 5 weeks. You can have symptoms, even if after a mild infection, you could have the symptoms called post-COVID symptoms. Next slide, please. So these are the symptoms like shortness of breath, lightheadedness, losing hair, and then difficulty in concentrating, like brain fog, cough, chest pain, headaches, palpitations, muscle aches, pins and needles all over. I mean, diarrhea, sleep, mood changes, fever, hair loss. I mean, when you see my video, you can see that I haven't got COVID, but I lost my hair, changing smell or taste, and even women, the menstrual cycles could be disrupted. Next slide. So these are the post-acute symptoms. So you have to be really careful. That's why we want to take a vaccine to prevent all these complications. Now let's get on to the new drugs that are coming out. So Paxlovid is one of the they call the Pfizer COVID pill. It's not published yet. This is the news report. So, I mean, we have to go with what we have. It's a drug that actually works to block the activity of the protease enzyme that helps for the viral replication. So it backs an enzyme that makes the viral replication happen. And we used another drug called ritonavir, which will increase the blood level of the vaccine, of the drug. And what this shows was that it reduces 89% reduction of the hospitalizations or death. So this actually really works very well if you start within 3 to 5 days. So now they are doing more study to see if you start within 1 day or later or before or after, whether things get better. So essentially this works very well. And when the hospitalizations were 0.8% on the drug versus 7% on the placebo. and no deaths were seen on the patient in the drug versus 10 deaths in the placebo. So you can see that this is really effective drug, which would be available in the future. Next slide, please. Next slide, please. So the molnupiravir is the drug developed by, it's a prodrug. That means that it has to be broken down into a second drug, active drug, pharmacologic active drug. And this is developed by a company called Merck. Molnupiravir also has a very good effect. And if you compare the drug versus placebo, the hospitalization and death was 7% on the drug versus 14% of the placebo. Statistically important, it's very well tolerated. So this is another drug that is available. So in the future, we will have two drugs that will be effective against COVID if you do get infected. Next slide, please. So in summary, the vaccines work against the variants. That's the best we have to protect ourselves. I do not think that you should think because there are drugs for COVID that I will avoid vaccine. That's a bad idea. It's hard to predict what will happen with variants. With the variants coming, we may have to change the vaccines, or even some of these medications need to be changed. Molnupiravir is good for early COVID, but I think Paxlovid is better for early COVID based on current information. And with that, I would like to thank you for listening to me, and back to you, Eliana.
Thank you so much, Dr. J. Great information. And I can see from the Q&A chat that a lot of people are asking some of these questions related to your content. So another reminder for all of you who have not entered questions, please use the Q&A feature at the bottom of your Zoom screen because the session is coming up soon. Now to our final panelist of the evening, Monica Grimaldi, a registered dietitian and certified diabetes care and education specialist for the University of Miami Health System. She's the program director for the Lennar Comprehensive Diabetes Center, which is certified and recognized under the American Diabetes Association. Now, Monica grew up in Miami. She earned her Bachelor of Science in Nutrition and Dietetics from Kaiser University and began her career providing diabetes education to pediatric patients and then evolved into adult diabetes education. Ms. Grimaldi has a passion for knowledge, and she's proud to be working with a multidisciplinary team to ensure proper education and care for her patients. Welcome, Ms. Grimaldi. Unmute yourself, and I think you're ready to go.
There you go. Hi, good evening, everybody. Thank you so much for that introduction. I'm very happy to speak about this topic as it is one of, or actually two of my biggest passions. It's food and diabetes. So if we can go ahead and get started. Next slide, please. Okay, so this is just the topics of the discussion for tonight. We're going to mindfully make good choices during acute illness or quarantine, how to create your plate to promote satiety and help manage blood glucose, listening to your body for hunger cues when in quarantine and or working from home, and also how to maintain daily activity while at home and adding recommended physical activity. Next slide, please. Okay, so a lot in this one slide, but so basically we want to make sure that you're mindfully making healthy choices during quarantine or acute illness. So quarantine, we're home all day long, so we want to make sure that we reduce anxiety as much as possible, and the goal is to boost your immune system. Okay, so how do we keep our immune system strong? Fruits and vegetables, right? We all hear it all the time, but why? They're filled with vitamins, with minerals that our bodies absolutely need for everything, for overall energy, for overall vitamins inside. So vitamin A, vitamin C, vitamin E, vitamin D, also our zinc and omega-3s and our probiotics. So it's just broken down into which foods have these specific nutrients in there. So we have our fresh fruits and vegetables, sweet potatoes, carrots, the leafy greens, our citrus fruits, our bell peppers, our nuts or seeds, vegetable oils. Then we have eggs, cheese, fatty fish, and dairy products. And then we have cashew, beef, and our egg yolks, and our fatty fish, nuts, seeds, avocados. So how do we do this? How do we keep it into our daily routine? We eat balanced meals. So that's including all our fruits and vegetables, our whole grains, our milk products, and our protein sources. We want to make sure that we have enough fluid intake, so make sure you stay hydrated and avoid the sugar sweetened beverages. And for acute illness, so for example, maybe if there is a COVID case, then you want to make sure you consume smaller meals, but still following the healthy guidelines. It's difficult when you feel sick, when you feel ill, to just go for fresh fruit and vegetables. So that would be the hardest part, and just avoid having these comfort foods at home. Next slide, please. Okay, so how do we get these foods to us if we're home, right? So consider getting groceries shipped to you or have a friend shop for you. Just drop it off at home. You want to make sure that you're limiting your shopping for the highly processed foods, the ready-to-eat meals, your packaged meals, your snacks. And then we also want to make sure that you have fresh or canned frozen fruits and vegetables. So you can do canned or frozen. You just want to make sure that you are reading the label. You want to make sure you look at the back of the label. No added sugars. You want to make sure you have no concentrated sweets and that you don't have added syrups or added sodium. When you read the ingredients in the back, you want to make sure, like, let's say you have fresh, a vegetable that's frozen. You want to make sure that there's nothing else added into that ingredient list, that it's just that vegetable that you're shopping for. And of course, you want to make sure you're limiting your fast foods and that you shop for the healthy snacks available at home, so that you're not constantly looking for, your cookie jar or things like that. You make sure you have healthy alternatives for you at home. Next slide, please. Okay, so now you have everything you need. You have your groceries that you've gone shopping for. So how do you make sure that you have a healthy, balanced meal? So you have a 9-inch plate, a typical 9-inch plate. Just make sure that half of that plate is filled with the non-starchy vegetables. So which ones are your non-starchy vegetables? These are your broccoli, your lettuce, cauliflower, green beans, asparagus. Make sure that you have a lot of fiber in your meals, specifically to help manage your blood sugar. So the fiber, fruits, vegetables, whole grains, that's what helps to absorb any extra fat, any extra sugar that we have in our body. So we want to make sure that half of our plate is that non-starchy vegetable. This will also help you stay full longer. So it'll help you stay full for the next 3 to 4 hours until it's the next meal or snack time. Then the other quarter of your plate, you want to make sure that you have your lean protein foods. So your lean proteins, fresh fish you can have, the lean meats, you can have chicken, tuna fish. So any type of lean protein that should be about the size of your palm. Okay, so about maybe 4 ounces per plate. And then the next quarter of your plate, so another side of it, will be your carbohydrate foods. So which are your carbohydrate foods? You have your grains, your starchy vegetables, you have your fruits, and then you have your dairy products. Okay, so these are, make sure that you have them on another quarter plate. And of course, based off the carbohydrate needs of everyone, is very individualized. So that's something that you can discuss on a one-on-one basis with a registered dietitian at your nutrition consults. And then you just want to make sure that you're drinking water or you're having non-sweetened beverages throughout the day. Next slide, please. So this is just 2 examples of what your meals should look like. So this is a lunch or a dinner. You want to make sure that your half the plate has the vegetables. Another quarter of it should be your grains and your starches. So if we notice, it looks like the size of your fist, almost about a cup or half a cup. So that's also depending on your carbohydrate needs. So it's always going to be very individualized. And then the other quarter, it's going to be the protein sources. Okay, so that's just 2 examples of different meals. Next slide, please. Okay, so now we're out of the house. What can you do for just so this continues, right? You want to make sure that you have healthy habits throughout, even after quarantine or illness. You want to continue to use the plate method. So just make sure that you always keep this in mind, that half your plate is always going to be that non-starchy vegetables. Even if you have combination foods, just like pizza, maybe you can add in different vegetables into there. You have cheese with that. So make sure you know which food group it belongs to. And then just make sure, even in family gatherings or even Thanksgiving that's coming up, we can still continue to follow this healthy habit as long as you just think of the plate. Where should each food group go? Next slide, please. Okay, and then healthy snack options. So you do want to make sure that you have snacks in between your meals. So for your blood glucose maintenance, you want to try to make sure that you pair your carbohydrate with your protein and your fat. So just 2 examples that I have here. So it's just a half a cup of yogurt with a sprinkle of granola and a sprinkle of blueberries. So that perfectly pairs the carbohydrate and your protein. And then we also have hummus with some carrots and green peas. That's gonna also compare the carbohydrate and the protein sources. So for snacks, definitely with the insulin administration, you want to make sure that you are following the carb ratio that you have you've done with your doctor, your physician. And then this is a snack is a great opportunity for the non-starchy vegetables or your fruits. So you want to make sure also that you have the 1 serving portions. If you're buying snacks like nuts, seeds, they do sell individualized packs, and you want to make sure that you have those available so that way they're grab and go versus you have a whole box of nuts and you might, forget that you're even having them, and it can go down to the middle of the bar. Next slide, please. Okay, so this is very important. You want to make sure, especially when we're at home or we're working from home, we're spending a lot of time close to the kitchen. So you want to make sure that you're listening to your body for these hunger cues. Great way to do that is just creating a schedule for your meals. So breakfast, lunch, dinner, especially if you're working from home, make sure that you give yourself that lunch break so that you don't go too long without eating. And then after work, what happens? We go to the kitchen and we're starving. So we eat everything that we see in sight. That's a normal reaction if we haven't eaten for many hours. So you just want to make sure that you create a schedule for yourself, and that avoids the frequent snacking. Eat slowly. That's a big one. Meals should take about 15 to 30 minutes. And then your snacks should take about 10 to 15 minutes. We want to make sure that we pay attention to our food, enjoy the food that you're having. Food should be enjoyable, so you want to make sure that you give that time with your food. Avoid any distractions. So for example, screen time or watching videos, working during lunch. You want to make sure that you are having that interaction with your meals so that your brain understands, okay, we're eating, so I'm not going to be hungry in another hour. A big one, sometimes we just get snacky, right? I like to say, okay, snacky, we're snacky. Is it your stomach or is it your brain? Most of the times, if we just stop and ask ourselves that question, it might be our brain. If it's your stomach, okay, go ahead and listen to it and go eat. But 99% of the time, it will be your brain, right? Sometimes we just, when we're bored, what else can we do? We have a little snack. If it's because of the lack of appetite from acute illness, just make sure that you are having these small meals throughout the day. Next slide, please. And then tips to maintain daily activity while at home. So acute illness, just try to get some fresh air. Try a walk around the neighborhood as medically feasible. And you want to make sure that you stand every hour. Versus laying in bed, of course, if medically feasible, versus laying in bed, make sure you just get up every hour. You can take a little walk around the house if you don't really feel like going outside, but just make sure you have that daily routine, the daily activity while at home. And if you are in quarantine from exposure, or majority are still working from home, you want to make sure that although maybe you're sitting at a desk all day long, you want to make sure that you do try to stand up every hour, walk around the house. You can also do short movements, like maybe, okay, every half an hour, get up and do 10 jumping jacks or 10 squats, something to keep you active throughout the day since you're missing that daily activity when you're at home. When you're at work. And then you can also consider home workouts since you don't really have to, you have a little bit more time. You don't have to drive anywhere. You're right at home, change into gym clothes. You can download any apps. You can do YouTube videos, and then you can also use your own body weight. So the squats, the burpees, push-ups, tricep dips, things like that, and make your own little high intensity workout, just 10 minutes a day, 15 minutes a day. Next slide, please. And then the physical activity recommendations. So 150 minutes of the routine physical activity a week. You want to try to make it a time that suits you. So there's no magic for anyone. Everybody's different. So if it's in the morning you prefer, or you prefer in the afternoon workout, you want to make it a time that you know you're going to be accountable for, that you're going to do it. And an activity you enjoy, because it should not feel like it's a task, or it shouldn't feel like it's homework. It should feel like something that you enjoy doing, whether it's walking or swimming or bike riding, dancing, yoga, something that you enjoy. And then grabbing a workout partner always works, because you're motivated to actually do it, right? You have a spinning class that you have to go to with a workout partner, and it's more motivation to actually go than just stay home. So this is just the physical activity recommendations overall for overall health, 150 minutes a week. Next slide, and I think that's it. Thank you very much for the time. I really enjoyed this segment.
Thank you so much, Monica. That was great. And a lot of the questions, again, you sparked just from your conversation. But let's get right to the final poll question for the evening. If you are unable to eat, you should skip insulin injections to avoid hypoglycemia. Is this true or false? If you're not able to eat, should you skip insulin injections to avoid hypoglycemia? Curious to see how people you would think in our audience would be pretty in the loop and aware of how to care for their health if they have diabetes, but let's see how they answered. Yes or no question. False. So Monica, 73% of the audience answered that correctly, correct?
So if you're unable to eat, skip insulin injections. So you want to skip your mealtime insulin. Yes, absolutely. But if you have a long-acting insulin, you want to make sure that you're still taking it. You might have to reduce it depending, or actually with illness, you might have to increase it. So make sure you have communication with your physician.
Perfect. Yeah. So the bottom line is it's not an exact black or white issue. It depends on the levels. Okay. All right. Let's get right to the Q&A question. And we have a lot coming in. So I ask our experts tonight to do your very best to answer them sort of succinctly and briefly so we can get to a lot of them. So what is better for the body? Eliminating sugar through the liver or through the kidneys? Which one of our physicians wants to take this first one?
I'll take that. So it's not better or worse. They are two different mechanisms, and there are medications that work on the liver, and there are new medications that work on the kidney. The advantage that we have with newer medications that specifically work on the kidney is that you lose calories, which means you lose weight. So that is the advantage of losing sugar through kidney by the drugs. But then there are other older drugs like metformin that work more on the liver and stop producing too much sugar from the liver side. So these are two different mechanisms, and often we end up using both depending on how high the sugar is, so that we take the best advantage of both mechanisms.
Perfect. Yeah. And of course, the new class of medications has changed the game a bit in that sense. All right, let's get to the second question. And there are a lot of related questions around this one, which is, after getting the first dose of the J&J vaccine in March 2021, do you recommend switching it up to the Pfizer or Moderna for the booster? And there are a flurry of these questions similar to that. Who wants to take that?
I'll take that one. So, I mean, the CDC has said that, it is perfectly all right to switch to Pfizer or Moderna, and, you get a better immune response by switching because the data has suggested that. But if you are nervous that there's a reason why you first went with Johnson & Johnson, because maybe you had allergy to other vaccines, and therefore that you picked. In that case, you should stay with Johnson & Johnson. But otherwise, I think it may get a better immune response if you switch.
And I would think because the J&J booster is not as readily available, what you might recommend is if you can only get the Moderna and Pfizer right now as a booster, get that as opposed to get nothing.
Absolutely. Get whatever that is available. The most important thing is to get vaccinated with the booster so that your immune response is adequate. Because if you got your first vaccine in, say, January, February, now 6, 7, 8 months, your antibodies are dropping down. This is the time that you need the booster. So if Moderna or Pfizer is available, take it.
Okay, perfect transition to this next question because you said your antibodies and so forth. There's a question out there that says, if my antibody load is strong, and we know that people are getting tested, getting blood work and finding out whether it's high or low, why do I need a booster?
That's a very good question. That's a very good question. But the reality is that the antibody tests we do, the quantitative antibody tests, are not really strong. It's almost like qualitative. So although they say that high, it's actually it's not a very scientific evaluation of antibodies. Only specialized lab can do the exact quantitative antibodies. So most of the time when they say you had a good response with antibodies, it could be just, marginally positive. And you may have the false impression that you're very immune, but actually you're not. So for one to think that I have great antibodies, so why would I get the vaccine? It's a very risky thing, because this test that we do is not 100% good. It's almost like qualitative. Very few labs do a proper, robust quantitative. We do at UHealth, but it's in a research lab, not in a commercial way, so.
Okay, perfect. Let's transition to a couple of very specific diabetes questions. This one is, I have type 2 diabetes, had COVID, nearly died after 2 months at Jackson Memorial Hospital. I had a stroke due to blood clots. I'm vaccinated and I have the booster. Could I ever become that sick again? And this person says they suffer from long COVID symptoms right now.
You want me to take it, Raj? Go ahead, you go ahead, Raj.
That's pretty unfortunate.
Yes.
So sorry to hear that from whosoever asked that question. The question is related to whether, despite COVID vaccination and booster shot, can they get breakthrough infection, right?
Yeah.
So I will suggest, yeah, there is a possibility. Dr. J can answer better, but you still need to be careful. Yes. Go ahead, Dr. J.
Yeah, I agree with you, Rajesh. So there must be some reason why you got so sick in the first place. So there might be, if there's an underlying sickness, as Dr. Garg said, that still would be underlying sickness. Having said that, and one of the things that we know is that if somebody had infection and you got a COVID vaccine, you have much better response than somebody who gets the COVID vaccine without the previous COVID infection. So your immune system is really top form because you had the COVID and you had the vaccination. So still there is a risk. So be careful because, bad things can happen. But your immune system, I think, is in a very good shape with the 2 vaccines, with the booster and a previous infection, but still be careful.
But take the flu shot.
Absolutely.
You're not protected against that, for sure.
Absolutely. So here's a question on someone who probably is resistant to getting the vaccine. If my immune system is working just fine, why do I need to get a vaccine that I never got as a child?
Rajesh, you want me to take one?
It's a tough one.
Yes.
Yeah, well, when in medicine, scientifically, we always weigh the risk and benefit. So what's the risk of you getting COVID against, even if your immune system is robust, you will get COVID sooner or later, and then your body will develop antibodies at the cost of risk. First thing, it is a serious disease, kills many people. and second, becoming sick. So sooner or later, whosoever is not vaccinated is going to get the infection. That's the natural course, majority of them. Some maybe lucky ones, but very small amount numbers. That just makes common sense. So rather than taking the risk of getting infection, I'll say the benefits of taking vaccine will be much better.
Yeah.
That's just my, yeah, Dr.
Mhm.
J, you want to?
Yeah, I think Dr. Garg's points are spot on, because I mean, it is true that we have so much faith. I exercise well, I do this well, I do that well, I eat well, I sleep well, and I never had a sickness. So why would I think that I would get COVID? That's how most of the people got COVID in the first place, because they thought nothing would happen to them, and they got. So our humble request to you is that why would you risk your life on something when we have decent protection with vaccine? Why would you take that risk?
Yeah, let science be our guide. And here's someone who apparently stays very on top of the research. I've read that serotonin reuptake inhibitors help keep the immune system high and prevent getting infected. Do you have any comments or perspective?
I'll take this one. So it is true, serotonin reuptake inhibitors not really can be used for prevention. It has been used, actually there was a study that came up recently that showed that the people with early COVID, these reuptake inhibitors would actually decrease the hospitalization and complications of COVID. But it has never been studied for prevention. So it is been, at least there's one study that has shown that it will decrease the hospitalization and sickness. Now, I am doing a study where I'm a little advertisement here, that actually looking at this reuptake inhibitors compared with the placebo, it will be starting this study in about a month or two, and so that people can take part in it. So I don't think it will, stop you.
Okay. And just finally, so we're all clear on this too, is it so that the booster is half the dosage of the original one that you got, or is that not true?
No.
Not at all. That's what a lot of people keep asking, and there's a few questions on that. So that's clear. And now, Monica, you have a chance here. Is the keto diet advisable for type 2 diabetes patients?
So that's a big one that we always discuss in clinic. A lot of patients are interested in the keto diet. It's just a matter of how you do it, and you want to make sure that you do it in a safe way. You still want to add some of those carbohydrates, like the fresh fruits, the milk products, some starchy vegetables, for those vitamins and minerals that you need from that. But there's a way that you can do it modified. Make sure that when you are doing just, keto, it's not just full fat and high saturated fats from protein sources. So that's another thing we need to consider. So you just want to make sure that we do it safely, and it's something that you do want to discuss with a registered dietitian specifically to make sure you're getting the right nutrients in that you need.
Perfect. Well, I think maybe one more question. Let me see if we have something else here that we can tee up real quickly. Yeah, we already talked about the high levels of antibodies and boosters. How about for Dr. J, Paxlovid and Ritonavir slow down metabolism, as I read. Does it slow mine or the virus? As a diabetic, I want a faster metabolism, correct?
No. What I meant was that the ritonavir will slow the breakdown of Paxlovid so that the blood level of the drug goes up. This has been used quite extensively with HIV drugs. By giving ritonavir, you can bump up the level of the other drug by blocking the breakdown. So that's a kind of a mechanism that we use very commonly in medicine. So it doesn't do anything to us. It is just the drug metabolism.
Well, we appreciate, because of all the scholarly work all of you experts do, that you talked to us conversationally and in a way that we can understand it, because this is very important information as a take home. So we thank our experts so very much tonight. We're kind of out of time and our program's come to an end, but our expert panelists and our audience were great, interactive, informed, and knowledge is power. So we at the University of Miami Health System, the Comprehensive Diabetes Center, appreciate your participation. Our experts, thank you for the privilege of your time and giving it to us so generously tonight. And we're here to care for you, the patient. So to make a virtual or in-person appointment with our experts, please call us 305-243-3636 and kindly visit umiamihealth.org and it'll give you more details there. All right, complete the survey at the end of this talk, provide feedback on your experience. And everyone out there, have a great night, get ready for Thanksgiving, stay safe, eat well, and stay healthy out there. Thank you so much, all of you tonight. Good night.
Thank you.
Thank you. Thank you.